In Chapter 9, we will discuss ways to control the growth of organisms. This is something that has been done for centuries and included the burning of clothes and corpses in the times of the ancient Greeks. Controlling the growth of microbes has been something that civilization has been concerned with for centuries. These methods used outside of the body include sterilization, disinfection, decontamination, and antisepsis. Sterilization includes methods like autoclaving that kill all types of microbes, including viruses and endospores. This method is used on non-living objects like surgical instruments. Disinfection has the ability to target vegetative cells, but not endospores. Bleach and iodine are disinfectants and are also used on inanimate objects. Examination tables and thermometers must be disinfected. Decontamination, or sanitization, is achieved through soaps and detergents. This is used in the restaurant and home settings. Antiseptic agents like alcohol can de-germ living objects. This particular table outlines physical methods, which include heat and radiation. It also details chemical agents such as gases and liquids. And lastly, it outlines mechanical removal. We will be discussing each of these, what types of objects they're used on, as well as what technique is used. These physical, chemical, and mechanical methods are all intended to target microbes that cause disease, as well as those that cause spoilage. Generally, this is a combination of microbes that all differ in terms of what method works best on them. Of all types of pathogens, endospores are the most resistant. Sterilization can target endospores and thus can target all pathogens. Let's look at the resistance of different microbes. The least resistant, meaning easier to target, are the enveloped viruses. At the intermediate level are gram-negative bacteria, like E. coli. We can see our endospores are the most resistant of our common microbes. Prions are the most resistant and difficult to target, but we won't be discussing them in great detail. Endospores can be up to 18 times more difficult to target than vegetative cells, and sterilization is the only method that can destroy them. Disinfection and antisepsis target the vegetative cells that aren't as tough as endospores. Sterilization and disinfection are processes, while agents are used in these processes. Anything that is a bactericide is an agent that kills bacteria, except the endospores. Agents that are cidal kill particular microbes like fungi, viruses, or spores. The goal of these control methods is to prevent growth of microbes in blood and tissue, which is sepsis. Aseptic techniques are practices that prevent microbes from invading sterile tissues and causing disease. Antiseptics may be used directly on living tissue and prevent vegetative pathogens from invading. Iodine can be used prior to surgeries, hydrogen peroxide in dental procedures, as well as basic hand washing with soap. Cidal means to kill, while stasis and static mean to stand still. A bacteriostatic agent prevents the growth of bacteria, while fungistatic agents inhibit fungi. Drugs, as well as antiseptic agents, are microbistatic rather than microbicidal, so that they aren't toxic to our cells. Depending on how a cidal agent is used, it may or may not achieve sterilization. Criteria that should be used to determine which method to use is how devices come into contact with patients. Critical devices, such as a sterile needle, that come into contact with sterile tissues must be sterilized prior to use. Semi-critical devices that come into contact with mucosal membranes, like endoscopy tubes, should preferably be sterilized. Those non-critical devices, such as a blood pressure cuff, should be treated with low-level disinfectants. A lot of substances require sterilization. These include rubber to sensitive liquids like serum. Each and every day, people in the healthcare setting must determine which methods to use, and not every method works in each case. Cost effectiveness and how the object is disposed of must all be considered. Disposable items like catheters, which are plastic, must be treated using gas sterilization so as not to damage them. Microbial death is when an organism no longer undergoes metabolic processes. It's not as simple as checking for a pulse to determine if a bacterium is alive. The only way we can tell is if the organism can reproduce when placed in a suitable environment. All cells will not die at the same time. It starts when a combination of time of exposure to an agent and its concentration. As the agent is increased, death occurs in a logarithmic fashion, with the active cells dying first. There are several factors that can influence the way an agent works. The higher the concentration of microbes, the longer that it takes to destroy them. What types of organisms are present also determines how the agent works. Environmental factors such as temperature and pH are also important. Generally, a larger concentration of a disinfectant is required. The mode of action and the presence of solvents also play a huge role. The antimicrobials can target a variety of targets. An agent that is least selective, like heat, can target a broad range of microbes. A selective agent can only target one component. A drug would be an example of one. The major targets of physical and chemical methods include the cell wall, cell membrane, DNA, RNA, and proteins. Alcohol and chemicals target the cell wall by preventing it from being made or by breaking it down. Detergents bind to the cell membrane, which allows chemicals to enter and ions to exit. Radiation and formaldehyde can target ribosomes and affect protein synthesis and can cause mutations. Moist heat and alcohol can denature proteins or prevent enzymes from binding to their substrates. Here we can see surfactant, the surfactant or detergent, inserting into the plasma membrane, which causes chemicals to enter. Heat is a physical method of control. High temperatures above the maximum growth temperature has a microbicidal effect and kills microbes. Lower temperatures slow the growth of an organism. Moist heat occurs in hot water, boiling water, and steam. Dry heat involves hot air or an open flame. Moist heat works at lower temperatures and requires a shorter exposure time. It is considered a microbicidal method, and its mode of action is coagulation and denaturation of proteins. Dry heat takes water away from the cell and denatures proteins. It can increase the stability of proteins, so higher temps are required. At extremely high temperatures, the cells are oxidized and burned. This occurs through the use of a Bunsen burner. Heat works by completely denaturing the protein, causing a conformational shape change, which prevents the substrate from binding or can block the active site. This table shows that moist heat can be as effective as dry heat but at shorter times. We can see at 121 degrees Celsius of moist heat, only 15 minutes are needed to achieve sterilization, compared to 600 minutes of dry heat. As I mentioned, endospores are the most resistant, and temperatures above boiling are required to kill them. Vegetative cells are sensitive and can be killed at lower temperatures and shorter times. Vegetative cells of those endospore formers are as sensitive to heat as vegetative cells of non-endospore formers. Pathogens aren't any more or less sensitive than non-pathogens. Fungi, protozoans, and helminths are about the same in terms of sensitivity to heat. Viruses are pretty resistant to heat. The thermal death time is the shortest amount of time required to kill all organisms at a set temperature. The thermal death point is the lowest temperature necessary to kill all microbes in 10 minutes. Anytime heat is used, it must prevent spoilage or infections without affecting the material. Boiling water is one form of moist heat that achieves disinfection. 30 minutes can kill most non-endospore formers. Pasteurization uses moist heat at short exposures to prevent infection and spoilage of beers and milk. It does not kill endospores, so is a disinfection method. Another form of moist heat is an autoclave, which uses steam and pressure to achieve sterilization. Incineration and the hot air oven are methods of dry heat and achieve sterilization. Cold, unlike heat, simply slows the growth of microbes. Cold temperatures can even be used to preserve cultures. Desiccation is a means of dehydrating a cell. Some microbes die, while some have the ability to be preserved. Lyophilization combines freezing and drying to maintain cultures in the laboratory setting. Radiation exists in the form of gamma rays, X-rays, and UV rays. And ionizing radiation, which includes gamma rays and X-rays, is a means of sterilization. It can be applied to drugs, vaccines, and food, just to name a few. Non-ionizing radiation, like UV rays, has the ability to disinfect surfaces. UV rays work by forming inappropriate bonds between nitrogenous bases. It can be lethal to cells. Filtration can be used to remove microbes from both air and liquid. The liquid is strained through a filter that traps microbes, but not the liquid. Viruses can also be trapped by controlling the size of the pores. Filtration can be used on liquids that cannot be subjected to heat, like blood or vaccines. It's used in water purification or to remove toxins. HEPA filters are also an example of a filtration method as well. Here we can see the filter, which has pores to allow the liquid to pass, but will not allow microbes through. A suction action is used to force the liquid through, and what passes through is free of microbes. A large amount of salt or sugar can cause plasmolysis of a cell. This has been a method used in ancient times, even before they knew about bacteria. It is not a sterilization method because it cannot kill endospores. The chemical agents can be in a liquid, gaseous, or a solid form. An aqueous agent is dissolved in pure water. Tinctures are chemicals that have been dissolved in alcohol or a mixture of water and alcohol. There There are several factors that a great germicide must possess. They must work fast and in low concentrations. They need to be able to dissolve in water and alcohol and be stable. A good agent should work against a broad range of microbes and not be harmful to us. The agent should be able to penetrate a surface and not be inactivated by organic matter. It shouldn't be corrosive or staining and should have sanitizing properties. It should be easily accessible to all people and be affordable. There are different types of germicides based on how well they destroy microbes in the medical and dental settings. High-level germicides can kill endospores, so are sterilides. Intermediate-level germicides can kill fungal but not bacterial endospores. A low-level germicide can only target vegetative cells and some viruses. Several factors have the ability to affect how the germicide works. This includes what type of microbe is being targeted, type of material, how contaminated it is, how long it needs to be treated, and the strength. Here are some common agents used to control microbes. Chlorine, at a concentration of 50 parts per million, can kill Mycobacterium tuberculosis in 50 seconds, while a 70% concentration of alcohol kills Staph aureus in 10 minutes. Every agent is different in terms of time and concentration required. In order for an agent to be effective, the exposure time must be substantial enough to act on the microbes. A smooth or solid object is easier to disinfect than one that has pores. Anytime a large amount of organic material like blood is present, it can slow penetration. Cleaning of instruments must also be done prior to the use of the sterilides. Let's look at different types of germicides. Chlorine can kill endospores, can be used to disinfect water, sanitize food equipment, and in the treatment of wounds. It works by denaturing enzymes. Iodine can kill spores by affecting metabolic functions. It can be used as an antiseptic on the skin and disinfectant of instruments. Hydrogen peroxide, which is an oxidizing agent, can kill endospores and is used as an antiseptic agent. Aldehydes work by targeting enzymes and other proteins. It can kill endospores and is used in sterilization of instruments. Ethylene oxide kills endospores by targeting DNA and proteins. It's used to disinfect plastics and other instruments that heat would damage. Carbolic acid kills some microbes, and its targets are the cell wall and cell membranes, as well as proteins. It is used in limited situations. It was recently banned from antibacterial soaps and gels. Chlorhexidine kills most microbes by targeting cell walls, cell membranes, and proteins. It's found in hand scrubs to prepare for surgery. Alcohols target most microbes and dissolve membrane lipids. It is used in degerming agents. Detergents target some microbes and affect proteins and the cell membrane. They are used in the clinical setting as a disinfectant. Metals, like mercury and silver, target some microbes and target proteins. They're used as antiseptics and preservatives in makeup. We can also use them as topical germicides. The next couple of tables outline products used on a daily basis and what category they fall under. Lysol wipes are considered a detergent, and Dial hand soap, a phenolic compound. Renew contact lens solution is considered a chlorhexidine, while Scope mouthwash is an alcohol.